The bed that's used in labor and delivery is specific to the purposes for having a patient who is in labor and the time for her delivery, as well as remaining in the bed, usually for a period of time for recovery. The bed is easily utilized. The end of the bed drops off. That helps make it accessible for the patient to deliver. The stirrups come up from underneath and they are lifted up and the patient's legs are placed there. After the use, those are easily placed back under the bed so that the patient can be in a regular bed type situation. There are 2 sets of handrails for safety, and there's buttons that control the bed's height and the head of the bed. And the patient is able to use those buttons as well as the nurse. There's settings on outside the rails and inside the rails, and the patient's able to use those. The bed has an easy rolling system to it, so that when the patient's through delivering and we want to move them to the room that they'll be in later, the bed is easily moved to a new location. There is an adjustment in the bed for the back. There's a firmness and a softness. It could be used for patients for comfort, but it's mostly meant to facilitate an exam where the patient needs more firm support in the lower back area, for example, a vaginal exam.